Hello again. This is Dr. Sinan Adnan. I'm an orthopedic surgeon from Germany. Today we will talk about a very important structure, which is the MCQ. Do you know how to answer each MCQ for the anatomy? What is the best time to create your very good degrees? And before we start, you can hit the subscription button here in the below part in order to see more videos like this. If you like, this is our page. Now, when we are starting, we have three sets of MCQ. We will go for the correct answers in each one and why other options are not correct. And at last, we will give you a time factor and time management for any MCQ you have. There is at the end of the video a bonus tip for indirect MCQs and how to answer it. Now, let's start, for example, in the first year examination for the anatomy, and you have the upper limb or the lower limb or thorax. In year 1 exams, we have simple examples. The first one, or first MCQ, is about an example of synovial joint. Is it intervertebral disc? The sterniomandibular joint? Is it sacroiliac joint? Is it the epiphyses or the distal tibiofibular joint? You can hit the pause button here in order to see your answer before this description. Now, the synovial joint is a joint that is held or circled by synovium. Others are fibrocartilaginous like intervertebral disc, a secondary cartilaginous like sternomandibular joint. The epiphysis is a primary cartilaginous joint, and the distal tibiofibular is a syndesmosis. So it leaves that the sacroiliac joint is the synovial joint with micromotion. And also, we have which of the following statement in regards of dorsal scapular nerve is correct. Now we have an indirect question here. It's a branch from C6 cervical plexus, passes through the scalenus medius, gives a branch to serratus anterior. It does not supply levator scapulae muscle, and at risk of injury, which runs superficial to the rhomboids. Give a pause, give your answer. Now, in C6, it's almost from C5 and sometimes contribution with C4. There's no branch to serratus anterior, and occasionally it supplies the levator scapulae rather. It enters deep, not superficial to the rhomboids, so it passes through the medial scalenus muscle or scalenus medius muscle is the correct answer here. Number 3, Flexor Digitorum profundus. Now there are statements about this muscle, so let's find out. Assist pronator quadratus in pronation. Supplies purely by median nerve, the strongest muscle of the forearm, partly insert into flexor retinaculum, an attachment of olecranon and the anterior part of the radius. Pause it, have your answer now. Now, if you see that it does not go with the pronation because this muscle is a digit flexor, and it is not only supplied by the median nerve the lateral half, while the medial half by ulnar nerve. We don't know if it is a strong muscle in the forearm or not. Partly insert in the flexor retinaculum, which is not because it passes underneath or posterior to it. And the attachment here is also wrong because it is attached to the ulna and the interosseous membrane. So it lifts the strongest muscle of the forearm is the right answer. Now, if you can see most of the questions like this, an indirect one is regarding the radial artery, which is true. Medial to the brachial artery in the antecubital fossa. It is in the middle third of the radial nerve, medial to it, and it lies on brachioradialis in the upper arm. It's medial to the radial nerve in the forearm, and E passes between the tendons of extensor pollicis brevis, abductor pollicis longus. Go for a pause, go for your answer. Now, if you can see that it is lateral to the brachial artery, it's not on the medial part, and the radial nerve is lateral to this artery. And when you see on brachioradialis, it means it is anterior, well, but it is posterior or under the brachioradialis. And also, it is posterior to these tendons, both of them. So let's have a note here. If you know that the brachial artery supplies and splits into the radial and ulnar arteries like a Y shape or inverted Y, so therefore the radial nerve is lateral to the radial artery and ulnar nerve is medial to the ulnar artery. And if you need to know, look at this picture. You will see that the brachial artery is splitted into radial and ulnar arteries, while the ulnar artery is medial and radial artery is more radial to it along the way of the course. So it left that it is medial to the radial nerve in the forearm. Let's take a look about the second year examination and with the bonus tip at the last of the video. Which of the following fontanelles is located at the junction of the sagittal and coronal sutures? What age? Posterior fontanelle, age 2, mastoid fontanelle, 16 months, lambdoid fontanelle, 8 months to 1 year, sphenoidal at age 3, anterior fontanelle, 18 months. Go for a pause and let's choose one of them. There is only one part which is correct, which is the anterior fontanelle located at the junction where the question asks, and it is on 18 months. Otherwise, all of them are not correct, especially the lambdoid. There is no lambdoid fontanelle. Number 2 is an indirect question about a case of a man in the hospital with headache and enlarged lymph node. The CT scan shows a tumor in jugular foramen. And the question is, what is the neurological deficit? Is it loss of the tongue movement? Is it loss of facial expression muscles? Is it loss of sensation at the face and the scalp? Loss of hearing? Or loss of gag reflex? Let's have a pause and try to answer this question. For this indirect question, we need to know that the jugular foramen exits 3 nerves and 1 which is internal jugular vein. And these 3 nerves are the 9th, 10th and 11th glossopharyngeal, vagus, and accessory nerve. And these nerves, which are inserted here, enters through the jugular foramen. So the question is about the glossopharyngeal and vagus nerve. Both have the supply, sensory and motor respectively, for the gag reflex. Any nerve compression here means no gag reflex. What about other choices? The other choices like tongue movement is supplied by the hypoglossal nerve, and it enters the hypoglossal canal, far away from our question. Facial nerve, which is the major supply of the muscles of the facial expression. Loss of sensation of the scalp, usually involvement of the trigeminal nerve. And loss of hearing is by the compression of the vestibulocochlear nerve, away from our question. So here's the question you can focus on, and you choose the gag reflex. Let's take another example here, and before that you can go for a screenshot if you like this question. Number 3, there is another case of a 20-year-old male admitted to emergency and intubated. The question is, endotracheal tube passed between vocal folds. What is the name of this opening? Go for a pause and try your answer. Now let's take a focus about these parts. Piriform recess is a recess in lateral to the laryngeal opening, which is not inside, enters this part. The vestibule is a region between epiglottis and rhymaglottidis. Also, we cannot enter our endoscope there. the ventricle area between true and false vocal cords, and vallicula is bilateral recess of anterior epiglottis. Rima glottidis is the opening between true vocal cords here. So the right answer is this one, E. So if you need to know about this, you can review your uh, summary books or this part of the picture. So we have a bonus tip about time. Most of the students got panic from time, so don't panic. Just wait for any question about it and take a deep breath between each MCQ. You have to manage your time according to a simple calculation. For example, if you have 120 MCQs in 90 minutes, so it left about 1.3, which is 129 seconds, and you can divide it into the 1 minute of thinking. Almost always you can think about in 1 minute in each MCQ. Read focus and try to take a breath in each answer. And you have 29 seconds to look on your bubble sheet and put your answers there. So this is a very important tip in order to not waste your time. If you like this video, so go for it and like the part of this video, and you can hit the bell ring in order to see more videos like us. We will always cross our fingers in order to wish you the good luck. Thank you very much. Have a nice day.